Members of the class of 2020 and your families, congratulations. What a tremendous accomplishment. When you entered the Baylor College of Medicine, you had no idea that you would live through one hurricane and a global pandemic. If you ever wondered about your career choice before, I hope that these challenges have given you clarity, focus, and a sense of purpose that few graduating classes before you would have. Because of these challenges that you have faced, you may not realize it now, but you have a real chance to inspire others in the future. When I graduated from medical school, the people who inspired me were legends whose careers had shaped the practice of medicine. DeBakey, Stead, Sabiston, Brownwald. At the time I graduated, they all seemed so distant to me, like they were in another world, another time, far ahead of me. Never seemed like I could ever do anything like them. But crises bring out inspiration and is much more tangible, much more present. I personally have been through many. The early years of the HIV pandemic, 9/11 in New York, 2 floods, 1 hurricane, 2 hospital fires, H1N1, 2 flu pandemics, SARS, MERS, Ebola, and now COVID-19. And in each one, I was amazed that some individual inspired me. Someone just like you, not those legends that I had admired in the past, and each one of you has it within you to be inspirational. So how can you inspire so early in your careers? What does it take to inspire others? Well, early in the HIV pandemic, no one knew how the virus was transmitted. It's hard to believe now, but hemophiliac kids who got HIV from their infusions were often ostracized. People were afraid to touch children because they were afraid they might get infected with HIV, even though we knew that was not the mode of transmission. I saw a group of pediatric interns hesitant to even walk into a room with an HIV-positive kid. It was incredibly awkward. And then one of the interns, a young woman, did not hesitate, entered the room and walked up to the kid and gave him a great big hug. Sometimes to inspire others, you just have to walk into a room when no one else will. On the morning of 9/11, we already had word that planes had hit the Twin Towers, all our air traffic was grounded, and we had no idea if there would be more attacks on the city. Many of my colleagues left our high-rise building out of understandable fear. But the disaster medical team that had prepared for events like this all ran to the emergency room, got their orders, and prepared for the onslaught of trauma victims that were sure to come pouring in. No one came. But that team was ready, most not knowing where their family members were or even if they were safe. In my mind, they were all heroes. And sometimes to inspire others, you just have to show up, even if no one comes. We had a terrible hospital fire at Mount Sinai in New York. A room that fed the main air duct for the hospital had an electrical fire, and smoke poured into the ventilation system throughout the hospital. After 9/11, firefighters were not allowed to go into a high-rise until the source of the fire was located, and since all rooms filled up with smoke at the same time, we couldn't locate the source of the fire. So medical residents, instead of firefighters, ran up the stairs and started evacuating 900 patients. To make sure all the patients were evacuated, the hospital president and I went up opposite stairwells, floor by floor, to make sure all the floors were empty. On the very top floor, I opened the fire door, and the smoke was so thick I could barely see the hand in front of me. And I called out to make sure no one was there. And a first-year resident emerged from the smoke, pushing the last patient to the stairwell and to safety on the only thing he could find, an office chair with wheels. Sometimes to inspire others, you have to make do with what you have, even if it's just an office chair. After Hurricane Harvey, Baylor students, including your class, wanted to help but weren't qualified yet to provide medical assistance. One of our students organized the others from all the Baylor schools into work teams and found faculty members who needed help at their flooded homes. Students went to faculty homes and packed clothes, ripped out carpets, cleaned up whatever the mess was. You students allowed distracted faculty members to return to work so they could provide care to patients or perform important experiments in their labs. The impact that you and other students had on these people was truly amazing. Sometimes to inspire others, cleaning out a garage is more important than putting on your white coat. This year, we've been overwhelmed by a coronavirus pandemic, with no previous immunity as run through communities across the globe. It scares everyone while we wait for researchers to find effective treatments. It is exhausting and dangerous work. But every day at 7 p.m. across the country, many people go outside and applaud the nurses, doctors, and healthcare workers risking their lives to care for patients. Sometimes to inspire others, you just have to go to work and do your job because people need you. I hope you understand that these individual acts by physicians and students just like you inspire people everywhere, and people like me to be a better person, a better doctor, and a more thoughtful member of the broader community. Because of your experiences here at Baylor, and especially during these crises, I believe each of you can inspire others to greatness in ways that others might not be able to. It doesn't take a career of excellence, and you don't need to be the most knowledgeable person to inspire others. All it takes is one act of courage, one act of inspiration. I want each of you to spend the rest of your careers recognizing those moments and being ready to stand up and be that person when it counts. And I know all of you can do that. Congratulations, class of 2020. I am so, so very proud of you.